World Cancer Day, 6 most common cancers for women and the symptoms to look out for. World Cancer Day is marked on the 4th of February each year to raise awareness of the disease and to encourage people to check for potential signs and take preventative measures. According to Cancer Research, cancer is the leading cause of death in the UK, with 1 in 2 people being diagnosed with the disease in their lifetime. Smoking is the largest single preventable cause of cancer each year in the UK, and 38% of cancer cases are preventable. The NHS states that there is strong evidence that regular exercise can lower the risk of developing cancer, along with a low-fat, high-fibre diet. The most common cancers in the UK for women are, in order, breast, lung, bowel, uterus, melanoma skin, and ovarian cancer. Awareness of symptoms is important as patients diagnosed at an early stage are more likely to survive because different treatment options are available for them. We've consulted the experts to find out more about how you can check your body for signs and symptoms of these specific cancers in an effort to keep safe and well. Breast cancer. Breast cancer is the most common form of cancer for women in the UK, with around 5,000 women under the age of 55 receiving a diagnosis every year, although it is more common amongst older women. According to Cancer Research, 1 in 7 women in the UK will develop breast cancer during their lifetime. Despite this, a large number of women don't check their breasts regularly for changes. A 2019 study by Bupa and HCA Healthcare UK revealed that 1 in 4 women admit they have never examined their breasts or can't remember the last time they did. Lung cancer. Lung cancer is the second most common form of cancer for women. Studies by Cancer Research reveal that 79% of cases are preventable, with almost 3/4, 72%, are caused by smoking. A further 8% of cases are a result of air pollution. Julia Ross, head of cancer care at Bupa UK, tells The Independent that lung cancer can often go unnoticed as many patients do not initially experience symptoms. Ovarian cancer. According to the NHS, ovarian cancer mainly affects women who have been through the menopause, usually aged 50 and older, but it can sometimes affect younger women. The most common symptoms of ovarian cancer are bloating, pelvic or abdominal pain, trouble eating or feeling full quickly, and changes in urinary habits, such as needing to wee a lot or having to go often. Dr. Shirin Lakhani, cosmetic doctor and intimate health specialist at the Cranley Clinic on Harley Street, tells The Independent. Other symptoms include extreme tiredness, back pain, constipation or pain during sex. Melanoma skin cancer. Melanoma skin cancer is the 5th most common cancer for women. According to Cancer Research, 86% of cases are preventable. Over the last decade, the rate of women being diagnosed with melanoma skin cancer has increased by more than a third, 35%. Dr. Ross Perry, skin cancer expert and medical director of Cosmetics UK, warns people of the damage the sun can do to skin and advises everyone to wear SPF all year round, even on cloudy days. Sun exposure is a known factor for increasing the risk of skin cancer, and even the British sun can, over time, accumulate and cause sun damage, he tells The Independent. Bowel cancer. Bowel cancer is the 3rd most common cancer for women. Almost half, 54%, of cases are preventable, according to Cancer Research. Bowel cancer, otherwise known as colorectal cancer, affects the large bowel. Bowel Cancer UK states. The large bowel, also known as the large intestine, is made up of your colon and rectum. Symptoms of bowel cancer can include a change in your bowel habits, blood in your stools, weight loss, pain in your abdomen or back, fatigue and feeling as though you need to strain your back package, even after going to the toilet, Cancer Research UK outlines. Uterine, womb, cancer. Cancer of the uterus or womb is the 4th most common cancer for women. According to Cancer Research, factors that may increase your susceptibility to uterine cancer include being overweight, starting your period early, a late menopause, and women with polycystic ovary syndrome (PCOS). Studies show that having children reduces uterine cancer by a third, and that the risk decreases with the more children a woman has. The most common symptom of uterine cancer is abnormal bleeding from the vagina, particularly in women who have stopped having periods, post-menopausal women. This can be bleeding that is unusually heavy or that happens between periods and/or vaginal discharge. Fortunately, 90% of uterine cancers are picked up early due to post-menopausal or irregular vaginal bleeding, leading to early diagnoses. Irregular bleeding is a common symptom of many other conditions, however, so it's important to remember that only a small number of women with irregular bleeding will actually have womb cancer. As before, it's important to contact your GP as soon as possible if you experience any of the symptoms mentioned here.